Guys, welcome to Pendant History. Hope you are doing good. I am Dr. Aishwarya with you for easy learning and better understanding. If you haven't subscribed to my channel yet, please go and subscribe to my channel and learn the dentistry in an easy manner. We are going to learn about the tweed analysis. Tweed analysis, it was given by Charles Tweed and it was given by Charles Tweed. He has considered the 2 points here, orbital as well as the Porion point. Only 2 points as considered in the Tweed analysis and three plane. Two, 2 points and three planes. Three planes were Frankfurt horizontal plane. When the Porion is meeting to the orbital, this makes a Frankfurt horizontal plane. And when the line is drawn towards the mandible, towards the line of the mandible, this plane is known as mandibular plane, and when the line is joining the lower incisor as well as the upper incisor in a long axis, that is known as the long axis of the lower incisor. So these three planes he has considered. If we are going to draw a line in three planes, that is we are intersecting the long axis of the lower incisor as well as the Frankfurt horizontal plane. So we are going to intersect at a point. That intersecting point is known as FMIA. Okay, this intersection is known as FMIA. FMIA. When we are going to intersect our lower border of the mandibular plane and the long axis of the lower incisor, then we are going to get here is IMPA. The full form I am going to give you. First we are going to see the short form FMIA and IMPA. When we are going to draw the line in Frankfurt horizontal plane and the mandibular plane, the intersection where we got is known as FMA. FMA. The intersection is known as FMA. Now, FMA means we are doing an intersection of these two planes. So, F means for Frankfurt mandibular plane angle. If you are meeting a two lines, if you are intersecting two lines, Frankfurt as well as the mandible, so Frankfurt mandibular plane angle. This is the FMA. FMIA means you are intersecting the long axis of the lower incisor as well as the Frankfurt horizontal plane. So F means Frankfurt mandibular incisor angle. You are meeting here Frankfurt as well as the mandibular incisor you are meeting. So Frankfurt mandibular incisor angle. IMPA means you are intersecting these two lines. These two lines known as long axis of the lower incisor and the mandibular plane. So incisor, this is the incisor mandibular plane angle. Mandibular plane, this is the mandibular plane. Incisor mandibular plane angle. Frankfurt mandibular incisor angle. Frankfurt mandibular plane angle. The name says the two lines are joining, so the name has occurred here. Objectives. Why we are doing this Tweed analysis? We are doing this Tweed analysis because for the evaluation of the prognosis, how much the prognosis is maintained by the patient skull. Okay, this analysis we are doing for evaluation of the prognosis and for determination of the position of the lower incisor. This lower incisor, this part, which type of positioning is occurring here, this we are determining by the Tweed's analysis. If we are changing this plane, if we are changing this line, then our whole skeletal region or the whole occlusion will going to change. Whole cephalometry will be changed. If we are getting a straight long axis of the lower incisor or tilted, this will make us to determine which type of angulation is there, whether the angle is high angle or low angle. So FMA, when the FMA is greater than 30 degree, this is 25, okay. If this has increased greater than 30, that means this region, this angle will going to increase. If the angle is increasing, this part is raising high, okay. This part is raising high. So patient has high angle here and clockwise rotation of the growth seen. Clockwise rotation, the mouth is opening and the clockwise rotation of the growth is seen. When the FMA is less than 20, less than 20 means this angle will going to decrease. Okay, this angle will going to decrease and patient has low angle. The mandible plane will be this will going to have a low angle. When the angle will decrease, the patient will have a low angle, and this is the counterclockwise rotation seen. Counterclockwise means when the clock is moving in this direction and you are rotating or you are against that direction, that is known as counterclockwise. So this is the counterclockwise rotation is seen of the growth of the region. Okay. IMPA, when the IMPA, this is mostly the 90 degree. Okay, this is the 90 degree. If this is raising, that means the raising means the proclination, lower incisor will going to proclined. If the angle is increasing, so the lower incisor will also going to procline, then only the angle will going to increase. No, so proclination of the lower incisor seen. And if IMPA is less than 85, that means like this, it is, so the lower incisor are retroclined. That means the lower incisor like this was retroclined, has come inside lingually, has placed lingual side. Okay, this was the TWID analysis. The importance of TWID's analysis is for classification, diagnosis, treatment, and planning and prognosis. Why we consider this TWID's analysis? Because it is used for the classification, for diagnosis, for treatment planning and prognosis of the patient. While positioning of the mandibular incisor, when you are going to position the mandibular incisor or when you are going to calculate the mandibular incisor, after any kind of malocclusion or something, extraction of the teeth also done after studying the analysis of the TWIDs. If the FMA is 20 to 30, as I have told you, FMA was present here. This was the angle. This was the angle. Okay, as you remember, this was the angle. So FMA was this. FMA 20 to 30. When the FMA is 20 to 30, there is the prognosis is good and excellent prognosis seen. When the FMA is 30 to 35, it is fair, good to fair. Okay. When the FMA is more increasing more, then unfavorable prognosis is seen. As the angle is increasing, the prognosis will going to decrease. The vice versa relation is there, that is indirectly proportional. As the angle is increasing, the prognosis will decrease. Now I have given the table here, FMA, IMPA and FMIA. This was the IMPA, incisor mandibular plane angle, IMPA, and FMIA, and this is FMA. So FMA, when the FMA 20 degree, the mean value is mostly 25 degree, 25, and the range is 16 to 35. When the range is 16 to 35 and the mean is 25, when any value come between this, at that time growth pattern is vertical. Growth pattern is vertical means the growth will seen in the vertical direction, and when the angle is decreased. When you are going to decrease the angle, the growth pattern will going to seen in the horizontal pattern. Okay, when it is increased vertical pattern, when it is decreased to horizontal pattern. IMPA, this was the lower one, this one, IMPA, when this is 90 degree, mean value is 90 degree and it ranges from 85 to 95, this is the range. When it is increased, the 90 degree when increased, as I told you, when the angle will increase, the proclination, the lower incisor will going to move forward. Proclination will be there of the mandibular incisor. When it is decreased, the lower incisor will going to decrease, come lingually. That means the angle, this 90 degree is decreasing. At that time, retroclination, that means the incisors are moving inside. Okay, when the angle is increasing, the incisors are moving outside. That is proclination, and this is the retroclination inside. FMIA, this is the angle. The mean value is 65 and the range is 60 to 75. Okay, this is the range. When the angle is increased, this was the angle. This was the angle here like this. When the angle is increasing, this is increasing. The FH plane will be going to be in the same manner. But when this angle is increasing means going outside, this will be going outside. When this will be going outside, the retroclination of the mandibular incisor will going to see. Okay, if the incisor plane, this is the long axis of the lower incisor was there, if this is increasing, that means long axis has changed, the lower incisor as well as the upper incisor has changed, and this will retrocline the mandibular incisor. Retroclines means the incisor will go inside. Okay, like this. Did you understood? That means if this angle is increasing like this, okay, so the upper incisor will procline and the lower incisor will be like this, retrocline. Did you got it? Retroclination will be there. Lingually it will going to adjust. And when the angle is decreased, when this angle is decreasing like this, okay, this angle is decreasing more, at that time the mandibular incisor and the maxilla will going to placed in the retroclination, and the mandible will going to procline. That means it will going to move in like this. If the angle has decreased, this will be the position, and the incisor of the mandible will going to see like this. Like this means the teeth has moved outside. That's why you are watching the teeth like this. Okay, like this it will be long axis. Okay, so this was the retroclination and proclination. This is very easy if you understood very well. And by using the angle, if you are studying, only the three angle is there. If you are studying this, so this tweed analysis is very easy, and even it is very important for the exam point of view and in your day to day. Thank you for watching Pen Dentistry. To know more about me, links are in description box. Don't forget to like, subscribe and hit the bell icon for the latest videos.